Another death in Kentucky is now being tied to the H1N1 virus. Health officials say a Boone County man in his 20s died from the virus. He did not have any underlying health conditions. This makes the 20th H1N1 related death statewide. Deaths have now been reported in most of the state's regions. And this comes as more children are getting the H1N1 vaccine at school. Franklin County Schools kicked off their vaccination program today. Meanwhile, many people who have not yet been vaccinated are trying to decide if the nasal mist or the shot is best for them. Wendy Enneking has some suggestions from health officials.
For weeks, we in the media have been talking about the H1N1 virus and the vaccine for it. Public awareness is certainly elevated.
It's just important, you know, the flu is terrible.
You probably know there are two forms of the vaccine.
The H1N1 shot, and then there's also H1N1 flu mist.
But do you really know what's different about them and which one you should get?
Healthcare providers say when it comes to choosing between the inhaled form or the injectable form of the H1N1 vaccine, most people can actually take the pain-free option.
Right now, we're really asking for people, if they're healthy, to take the nasal because we do have a lot of that.
The mist is a live attenuated vaccine.
It just means they've taken a small part of the flu virus and put it into a mist form of the vaccine. That's sprayed into both sides of the nose.
The flu shot is an inactivated form of H1N1, best for high-risk populations.
Pregnant women, those people who are caring for children under the age of 6 months, anybody who's the age 6 months to 24 years of age, because they seem to be getting a little bit sicker with the H1N1.
Dr. Hood says neither vaccine will cause the flu.
If you do get some symptoms after any vaccine, your immune system is responding.
And says that even though the H1N1 vaccine was produced quickly, it's just as safe as the seasonal flu vaccine.
They used the exact same process and the same ingredients. They just knew which virus they wanted to put in this one and then sped it up so that we could try to stay ahead of this virus.
Wendy Enneking, WKYT 27 News First.
And Dr. Hood says if you do come down with flu-like symptoms after getting the flu vaccine, it's not probably because of the shot, but rather something you encountered around the same time that you were vaccinated.